Hello, guys. Diabetes Month continues, where we're talking about diabetes and its effect on different organs of the body. Today, I want to talk about diabetes and its effect on the brain. The brain functions by oxygen and energy sources from sugar mainly. This sugar and oxygen is carried by red blood cells coming through blood vessels to different parts of the brain. These blood vessels are in different sizes, and there's a signal that determines, oh, give me this amount of blood or reduce the amount of blood that's coming. Earlier, we talked about the importance of insulin. And insulin works by determining how much sugar is driven into the cell to be used, cells of the brain included. So, absence of insulin in type 1 or a resistance of insulin in type 2 would cause the blood vessels to be less sensitive to how much sugar is actually needed. And also, we increase the amount of gluconeogenesis, that is, the production of sugar from non-sugar sources. Proteins are broken down, there's damage to blood vessels, and the brain is deprived. So this is the resulting of this deprivation. We have what we call diabetic stress, and this is as a result of high blood sugar damaging the blood vessels, reducing how much blood or oxygen is actually carried to the nerves or cells of the brain. This can cause death or brain atrophy of the cells in the brain. Features of diabetic stress include accelerated aging of the brain cells. Brain goes older. There will be mild to moderate cognitive and memory function. Brain activity is going to reduce. Reasoning is going to be affected. Memory loss will be more common with people that have diabetic stress. There will be a mood shift. You notice that these people are more irritable. There will be fatigue. There will be confusion. These people have difficulty learning stuff. And of course, you mentioned before that there's a problem with memory. Even if they learn it, after taking so long time and they learn, they easily forget. People forget things like addresses, names, where they place stuff. There will be hormone changes, the irritability, the memory loss. All this can be called into one group called vascular dementia. Have a higher risk of having Alzheimer's disease. People that are pre-diabetic also have a higher risk of having the Alzheimer's disease. Even if you're pre-diabetic, make sure your sugar comes down and you go back into the normal group. Thank you for listening. I'll see you guys on the next one.